Hello, so we have a nice presentation about ADHD. Myself, Melody, Shener, Yvelisse, and Jasmine will be presenting exactly what attention deficit hyperactivity disorder is. It is also known as ADHD. It's a medical condition in children. It is early detected from pre-K, where a child has three main symptoms. One of them is an inattention. The next one is hyperactivity and impulsivity. A child who has inattention is unable to pay attention and is highly distracted. A child who has hyperactivity cannot sit still and is just jumping all over the place. A child who has impulsivity is a child who does not think before doing its actions, which causes them to be very active and hyper. So now I'm going to move on to Jasmine, and she's going to discuss getting a diagnosis.
Okay, so to get an accurate diagnosis for children with ADHD, you must go to a qualified physician or ADHD specialist so they can use strict diagnostic guidelines or special tests to make sure that your child has the proper symptoms of ADHD. Also, for ADHD, they have several disorders that accompany ADHD, which is bipolar disorder, Tourette syndrome, or anxiety and depression. And now we're going to have Yvelisse to tell you what causes ADHD.
Well, research have not found a cause for ADHD. They do believe there's a chemical imbalance in the brain that may cause the behavior. A mother that has been either smoking or drinking may cause the child to be born with ADHD. In addition, treatments that are best for children with ADHD will be behavior management, medication, and the appropriate educational programs. This will help, especially with medication, control their motor-like behavior. Now I'm going to discuss Nielsen's view of ADHD. He believes that it's a behavior disorder will be the deficit hyperactivity disorder. These will there were three types. It's a combination type where the child experiences inactive and hyperactive impulsive behavior. It is the inactive symptoms a child can sit for a long period of time and no impulsive behavior, but are easily distracted. The hyperactivity impulsive type, the child loses their focus easily because of the lack of self-control and impulses. Nielsen feels that as educators, we should not diagnose the child with ADHD. It is the recommendation of a professional, a psychologist, or psychotherapist and families to make the decision, including medication and behavior plans for the child. Now I will be given the opportunity to Shener to continue.
All right. Hi, everyone. Okay, so now we're going to go over what I have right now is the lesson plan. It was we did it for a second grader. The subject was science literacy, and it was our five senses. So as you can see on here, we're using the senses to assist and guide learning. We're going to ask the questions and make predictions based on observation and manipulation of things and events in the environment. We're also going to exhibit curiosity, interest, and willingness in learning new things and having new experiences. So the learning target would be, as a result of the lesson, students will, one, be able to use their five senses of sight, smell, hear, taste, and touch. Two, you're going to identify which center is showcasing each different sense. And 3, be able to work in a group together to identify which senses are being used in that center. The activities and tasks, whole classroom instructions would be, the teacher is going to play a game to ask students to point out their eyes. Teacher will then ask students to stand up in front of their seats, point to their nose, ears, mouth, and hands. Teacher would then say, today we are learning how important our eyes, our nose, our mouths, our hands, and our ears are, because they help us explore the world as around us. Now, for this, the group activity, the students will be asked to sit down at their table. It will be about 5 tables. Each table will have a bin with items in the bin. Blue bin would be books and animals, picture cards for eyes. The green bin, scented toys or perfumes for the nose. The pink bin, headphones for audiobook and or iPad for ears. The red bin, Play-Doh, different texture toys. Teddy bears, soft, such as hard as a baseball. Now the purple bin will have cookies or candy for the mouth. The bins will not be made. They're just going to be identified by color and group. Now the whole class, after rotation of the groups, each group will be asked to present which bin they thought each 5 senses was represented. So the formative assessment would be, after each sentence are rotated, the teacher will call on each group and have a volunteer tell the class what conclusions they came to after exploring all items in the bins. The teacher will tally a chart paper to see which groups were correct. If time permits, the student will complete the worksheet that matches 5 items to the correct senses. The materials you're going to use would be chart paper, markers, books, pen, cards, headphones, iPad, cookies, candies, perfume, scented toys, Play-Doh, teddy bear, the blue bin, the red bin, purple bin, pink bin, green bin. So as we continue as well, the differentiation for ADHD, students will be provided with 2 bins at a time. For example, students will have to identify the red bin for hands and purple bin for ears, and then go to the next 2 bins. Students will have a one-on-one assistance when needed. For further assistance, student can receive a table that can help them with the meaning of each 5 senses. The exit assessment will be for students to match the pictures to the correct senses, as you can see below. Now we're going to turn it back over to Melody, where she's going to go over the IEP, sample IEP, and she's going to tell you about that.
So a completed sample IEP is just a description of a child who has ADHD or any disability. It has a description, his birthday, his name, age, and it also has the level of performances the child has. So what is his present performance in all academic levels? It also speaks about its social development, it is physical development, and its annual goals that needs to be met by the end of the school term in order to have the child reach where it needs to be. So the IEP is just basically a guide for teachers and parents to help them teach their child and meet their goals. So this is an example of what it looks like. And by the end of the IEP, it's just a summary of what happens and if any recommendations are needed. So that is our presentation for ADHD. If you have any more questions or concerns, you can go to our website. It will be linked to this video. Thank you. Bye-bye.
Thank you for watching. Bye-bye.